Good afternoon, everyone. Welcome back. Thank you for joining us. We're glad that you're here. I'm Steve.
And I'm Scott.
And together we're Backyard Musings, the Science and Technology channel.
Yep, and we are talking about another health issue, a type of drug. So here we go. We're going to get into it.
This is really cool. Researchers have uncovered an early survival response in ovarian cancer cells that may limit the effectiveness of widely used PARP inhibitors. A new study from the Mayo Clinic researchers reports that ovarian cancer cells can quickly switch on a survival response after treatment with PARP inhibitors. Blocking this early reaction may help these drugs work more effectively. This research was published in Science Translational Medicine on January 14th of this year. Would you like to know more?
PARP inhibitors are widely used to treat ovarian cancer, especially in tumors with defects in DNA repair. While many patients initially respond, the benefit often fades over time as tumors become resistant. And we've talked about that type of cancer before, right? And I think pancreatic cancer, we've talked about stuff.
Yeah.
This study highlights an early mechanism that may allow cancer cells to survive treatment and suggest a way to interfere with it. Okay.
Researchers found that ovarian cancer cells rapidly activate a survival program soon after exposure to PARP inhibitors. A key player in the process is FRA1, a transcription factor that turns on genes that help cancer cells adapt and avoid cell death.
Quote, this work shows that drug resistance does not always emerge slowly over time. Cancer cells can activate survival programs very early after treatment begins. And this is according to Arun Kanakanthara, PhD, an oncology investigator at Mayo Clinic and a senior author of the study. Going on with the quote, by targeting that early response, we may be able to improve how well existing therapies work and potentially delay or prevent resistance, which would be a great thing.
Yeah. The team explored whether Brigatinib, I'm going to spell it, Brigatinib, an FDA-approved drug used for certain lung cancers, could block this survival response and boost the effectiveness of PARP inhibitors. The drug was chosen because it targets several signaling pathways that cancer cells use to stay alive.
Excuse me. Results showed that combining Brigatinib with a PARP inhibitor worked better than either drug alone. Notably, this benefit was observed in cancer cells, but not in normal cells, suggesting the approach could be more selective and potentially safer. I like that too.
Researchers also uncovered a previously unknown way Brigatinib works. Instead of affecting traditional DNA repair pathways, it blocks two signaling molecules, FAK and EphA2, which aggressive ovarian cancer cells depend on for survival. Disrupting both pathways at the same time reduces the cell's ability to adapt and resist treatment, making them more sensitive to PARP inhibitors.
The study also points to a possible way to identify patients who may benefit most from the strategy. Tumors with higher levels of FAK and EphA2 showed a stronger response to the drug combination.
Other findings suggest that ovarian cancers with elevated levels of these molecules tend to be more aggressive, which could make this approach especially useful for harder to treat cases.
Quote, from a clinical perspective, resistance remains one of the biggest challenges in treating ovarian cancer. And this is according to John Werhoa, MD, PhD, a medical oncologist at Mayo Clinic and a senior author of the study. Going on with his quote, by combining mechanistic insights from Dr. Kanthara's laboratory and with clinical experience, this preclinical work supports the strategy of targeting resistance early. Before it has a chance to take hold, the strategy could improve patient outcomes. Okay.
Overall, the findings offer new insight into how ovarian cancer resists treatment and suggests a promising path for improving therapy by targeting early survival signals.
Okay, well, let's
Love it.
hope that this strategy will improve patient outcomes soon. So it's good story. Yeah, we like these kind of stories.
Yes, we do. All right, folks, thanks for joining us. We'll catch you in the morning.
We'll see you tomorrow. Take care, everyone. Have a good night. Thanks.